Good morning, good afternoon, and good evening to all of my friends out there in the global community. I am so excited to be here with you this morning. I'm a little tickled inside because for the first time I'm using my computer desktop instead of my cell phone, computer desktop, and laptop to come to you on Facebook Live, as well as to have the capability to make a YouTube video, as well as to the capability to tape the podcast. So I want to thank Carla for helping me to get it all on the screen, so it's all here in front of me. I feel like it's a big science project. It's totally awesome. This morning we had a discussion yesterday, and we have a lot of guests that we're lining up for Life is a Sacred Journey. It is real difficult, to be honest, to get someone to talk to every single week. But this week I had the opportunity to be engaged in a couple of things in my other life that had to do with COVID-19 and relaunching and having people come back into a church, sacred spaces within the Cal Nevada Conference. And then in my position as CEO here at Alzheimer's Services of the East Bay, we have begun to talk about how we can relaunch our programs. Our board met last night, and Carla McManus, our program director, met with us, and we began to have some vital discussions around, what is that going to look like? And so I thought I would bring, because we have been open and we have been serving high-risk individuals in our community, meaning high risk as far as their health status, because I think when we say words like that, those words stick to us like Velcro. These are incredible human beings, but they're high risk because of secondary diagnosis. Please hit the share button. Make sure we get other people to join us as we get into this topic. Like us on Facebook, subscribe, always hit like or love on Twitter or all those other places where we are. But please hit the share button now, and let's get more people to be with us this morning on Life is a Sacred Journey. So I'm going to start by answering. Carla attended a webinar, and Carla has called in, so she's available to assist me in clarifying any of the things that I am talking about as it relates to COVID-19 and our relaunching. But I wanted to start with a webinar that was held by the Adult Day, California Adult Day Services Association, and they had a physician, Dr. Rutherford, as their guest, and they did a Q&A. And so I wanted to, I picked out some of these questions because these are questions that are coming up in our day-to-day. And one of the first questions that I picked up, because I think we all need to talk about this: does the type of mask make a difference, or is any face covering helpful? And his response was, any type of face covering is helpful. However, for your staff, 2 layers of material are better. Adding a filter is even better yet. So what I did is pull out some masks for you. And what I found, so this is a mask that was made by someone, and they were donated to ASEB. If you flip it open, there is a pocket here. Okay, you see, there's a pocket. So for some of us, you can take this mask, and I'm gonna put it in here for you, so you can see what I'm trying to do here. You can put that mask in there, stuff the little sidebar thingy, this little thing. And so now you have a mask that has something that will absorb the moisture so that it doesn't get that, for me as an asthmatic, the minute that the fabric of the mask gets wet, I have a difficult time breathing. And I notice having on a mask for me more than 30 to 35 minutes I start to feel like I'm hyperventilating and kind of suffocating. So I suggest that if this is another way to help, or people have told me that just wearing this mask, which if I can get it back out of here now, I've broken it, but it's show and tell. And so this one, because it's a fiber and it has a little bit more, it's just a little bit more pliable. It's a thinner fabric. So it's this mask seems to work for a lot of our elders. And these are the masks that we will be using in the program. I also love, this is the KN95 mask that everybody, in the beginning that we had a shortage of. I love this mask because what it has is this wire at the top. And that's why it's important to put your mask under your glasses, push the wire down around your nose so it fits. Everybody, one of my colleagues here, every time he comes in my office, his mask is all helter-skelter all over the place, and I have to tell him to get out of my office. And this is important, pushing it down, particularly if you wear glasses, so that you don't have that air going up and fogging up your glasses. So these masks are great. And if you're making them, I have a friend that made one, and she actually put a wire at the top of it. So that's my favorite mask. So make sure that you're looking at the mask that you're wearing, and make sure that you're, not creating more respiratory problems for yourself by not, having your mask on. Okay. Also, that was a very good question. The next question that was asked: we are thinking of doing temperature check and some questions before entering the building. Is there other ways to check for COVID-19? And this physician said is that folks that are working or with high-risk individuals, exposures, should be tested every 2 weeks is advisable. And then when people return to our program, it will be, we will have to test them once a month. So thinking about relaunching also is creating a relaunch budget. I think that in my other life with the churches, that's one of the areas that I've been emphasizing. Think about the budget, because these things can become costly over a period of time. Good morning, Belinda. And then this is a great question, because I never thought, universal precautions is about all body fluids, but I really this question never came up for me. And the question was about covering the toilet lid before flushing the toilet. Is it recommended to reduce the spread of risks for both staff that are caring for and seniors? And it says the virus has been detected in fecal material, although how it manifests is not clear, and how it transfers is not clear. So it's always a good idea to use the idea to close the toilet lid to prevent water droplets being sprayed from the toilet bowl into the air and onto the floor. And bathroom sanitation is important. And so these are things that we already know, but these are things that will help us as we continue to understand, how we're going to live in this new way, so we don't have or get ourselves exposed to COVID-19. This was a good question. Face shield versus mask. Well, the face shield, I should have brought one in. The face shield is great if you're going to be exposed to, I think, the public. My local CVS out on Treat Boulevard in Concord, they have a plexiglass shield, but they also are wearing the shield, the personal shield, and they're also wearing masks. So that's a great way to ensure that people aren't transferring bodily fluids across the lines. This is another question that someone asked me because of public transportation. As we all know, transportation, is really hard for our seniors. So many of our seniors use paratransit and public transportation. And the question was, would you recommend any elderly folks to use paratransit, avoid paratransit, where there are 3 to 6 people on the bus with them up to an hour. And he says, the less time spent with another person outside of one's bubble, the better. Masks are a must, and then you have to sanitize every single thing. Hand wash the person's hands before they get on the van. Do the temperature check before they get on the van, and then make sure they're doing that social distancing on the ride. So if you think about a paratransit van, it has 8 to 15 seats in it. So how many people could you actually get in a run back and forth to any place? And so it's just thinking and looking at that from a different perspective. And I know we're thinking about it and what would that mean? So, but for public transportation, I think we have to be very careful. I think that we have to be careful with public transportation because we don't know how many people are on those buses or whatever, and so we're telling our staff that use public transportation to work telephonically, so or figure out another way of getting to one of our locations. So let me just say good morning to a couple of people here. Good morning, Renee. Thank you so much for your advocacy during the budget. We all were, and all of you out there, I know many of you, United Methodist Women in droves called and texted. Thank you so much for hearing that shout out. To all my siblings within my faith community, thank you. All of my Facebook friends, thank you. And all of my colleagues, thank you for really saying no, stop cutting the budget to the seniors every single time you think we have a crisis or we are in crises. Our seniors are not disposable. So thank you all for that. So good morning, Renee and Dion and Paulini and Teresa and Joanne. Thank you all for being really good fans of Life is a Sacred Journey. Please hit your share button and share it with other people out there in the universe, because we want to share. So let me get back to some of these questions, because I want to make sure in your work and where you are and in your context you can share. And then I see callers here, so we may be able to ask her to share some of the things that she's been thinking about or what she's learned. So one of the and I think this is a phenomenal question. What is new about the time spent with symptomatic persons with or without the mask? How is that affecting the chances of transmission? So symptomatic persons with or without a mask, how much time? People who have symptoms, this is the response, should be at home. You should always wear a mask around others who have symptoms and maintain physical distance when possible. People with symptoms need to be tested and, if possible, isolated for 10 days. People who have been closely exposed to them also need to be tested, and the less time spent with a person with symptoms, the better. And so, again, the debate about the mask. This is the one thing I'm going to shout out. This is my public service announcement this morning. Wear the mask, people. Yesterday, I fell upon somebody on YouTube, or these people were testifying in a state, and I can't remember where the state was, but they were blasting their board of supervisors in that particular county community for making it a mandate that people wear masks. And I just found that to be utterly selfish and self-centered. And then I started to think about, okay, Micheal, take off your judgment hat. And then I started asking questions. Why have we as a community, as a humanity, gone so far to the left that it's all about us as one unique individual, created wonderfully, but one unique individual, that we think we can do anything and that everybody else has to just live with whatever we do and say? We've evolved into this humanity where it's all about me. I don't want to wear the mask. I don't like the mask. I don't believe that there's a COVID-19. It's a conspiracy theory that aliens have fallen down out of the sky and the. Well, I think to the thousands of people's families who have passed away from COVID-19, they know it's real. They know the grief that they feel. They know the loss that they feel. They know that they were not able to visit their loved one while they were suffering and gasping for air. So they know that COVID-19 is real. And so for those of us that have not been touched by it, instead of running around and saying don't wear a mask, have a sense of gratitude that you haven't gotten sick and put the doggone mask on so the rest of us don't get sick. And you know, I want to say something to you too when I see you at the grocery store or see you at my local Ace Hardware. Everybody knows Ace Hardware on Clayton Road, my favorite place in the whole wide world. But put on your mask. And I shouldn't have to be your police, and I'm not going to police you. But I am going to look at you some kind of way when you don't have your mask on, and I probably am going to mumble under my breath, and then I'm going to pray for you. But I'm not going to say anything to you, because if you're the type of person that won't put a mask on when you know that we have a pandemic, then I can't engage with you, because that means you're going to want to fight, and I'm not trying to do that. So let's put our mask on. I hate the mask. I'm an asthmatic. I can hardly breathe. I feel like I'm drowning half the time. But for the sake of humanity, for the sake of the people that I love, for the sake of the world, I'm putting the mask on. And I'm actually trying to find really cool ones. You can notice that this matches my outfit today. So wear your mask, people. And oh yeah, Belinda says that happened in Florida. So yeah, people in Florida love you. Love you, Florida. I got good friends in Florida, but put your mask on, because I got good friends in Florida and I want to see them after the pandemic. So the other good question, and I'll end with the questions and then have Carla weigh in on some of the things that she's hearing and learning about, and then we'll go into some of the sanitation techniques. And the question is, what kind of screening tests can we offer to seniors if and when, meaning from if we're going to open back up, or for employees? There are free clinics all over the state, all over the counties. You can go online. I looked it up myself. I went in on my laptop on Google and looked up COVID-19 free clinics, and I have found plenty of them. There's also, if you're in Alameda County, the Area Agency on Aging website has a plethora of resources for you to access where it comes to nutrition. If there's something going on with your landlord, if they're starting, because I'm starting to hear that landlords are starting to get, you know, a little antsy and needing their rent, and even though we have still a no eviction order in place, it's getting a little wishy-washy. So on that website, you can see all the resources, getting nutrition, getting tested, all of that. And every county has a website pull down page now with resources. Anything that you really want to know about transmission, cleanliness, I'm going to tell you to go to the CDC website. I have gone to the CDC website, and they have relaunching criteria for every single industry. So I really advise you to go there. They have incredible videos that you can use to train your staff or to share with your family. I think this is a time to sit down and have a conversation with your family about COVID-19, especially if you begin to open your social bubble. And the social bubble is the people you've been hanging out with since COVID-19. So for an example, my son and my daughter-in-law, we have not physically been together since sheltering in place. So we continue to not be together in sheltering in place. So we do everything on Zoom. We had dinner on Zoom on Sunday. My daughter lives in the home with me, and we have been close together, so she's a part of my social bubble. The people here at my job, at Alzheimer's Services, I hate to call it a job because I love it, and that implies I don't. But here are a part of my social bubble. And then I have two individuals in my life that I visit on an ongoing basis. They're in my social bubble, but they've been in my social bubble from the very beginning. I haven't added any new folks to the social bubble. So that's a social bubble. And if you have folks like that in your life, then you can continue to still, practice social distancing, still wear the mask, but you can have more opportunity to hang out with them and not feel so alone and separated during this time. So Carla, I see that you're there, and I just wanted to ask you to share with our Life is a Sacred Journey audience some of the things that you're hearing from the county and from the Department of Public Health and the Department of Aging excuse me, around all of the openings and sanitation and all of that.
Good morning. So one of the sanitation is going to be key.
I'm going to ask you to speak up a little bit, Carla.
Everything's going to have to be cleaned. We're going to have to make sure that we have enough time to make sure everything can be cleaned. So again, that's going to mean for us shorter days to have people in the center to allow us to have time to clean. That's going to be really key in making sure that all the staff is cleaning everything and anything in the building. That's going to be a challenge.
Sorry.
So much space here, and there's so many people in and out of the building when we start having participants in. As well, making sure we have secure drop-off procedures so that we don't have excess people in the building, as well as pickup procedures, that we're monitoring people that are coming in before they get in the building, even their staff, making sure that they don't have any symptoms, that their temperature is taken before they come in. So there's just a lot of different things that we have to think about and prioritize and make sure that there's policies and procedures in place before we can start allowing more people in the building. And right now, that's really hard because as things are opening, people are just wanting to get out. They're wanting to get their loved ones back in the program. And, it's really hard for them to hear, well, it's really not time yet. We still have to figure all this out because we want to make sure that everybody is safe. That's got to be key.
Yeah.
One of the other challenges we're having is we do have people with compromised immune systems here. We have people with asthma, COPD. Yeah. So what do we do with those people that they can't tolerate a mask? So how are we going to feasibly work with them? So making sure that we do have policies in place for the people that are coming in that can't wear the mask so that our staff is protected too and that they're protected from the staff. So, trying to just sort out all the different odds and ends that are going to go along with it.
And Carla, that's a good point. It's about a cross protection. Good morning, Teresa. Good morning, Mary, Belinda. I'm so happy that you, Joanne, are all with us this morning at Life is a Sacred Journey. Please hit the share button and let other people know that you're on Facebook Live with us. And don't forget to like us and subscribe on YouTube. And what Carla is talking about is sitting down and coming up with a plan, which is something that we have to do for the county and for the state, something we've done in my other life where we've had to sit down and really work on the plan, but know that that plan is a moving target because everything changes. Every single day we get new information, new things that we need to do, and I'm always just amazed at how that plan that we wrote back in April has changed so much now that it's June. So I just think it's, or July actually, next week. So I just think it's really important that you begin to do that. Hand sanitizer is great. Making sure you wash your hands, making sure the water is warm enough so that you are experiencing some cleanliness and cleaning of germs. And I know I've been to some places where the water is cold, and you're not cleaning your hands in an environment such as that. It's better than nothing, but you do need warm water. And if that's the case, then use hand sanitizer after. Hold on to your cloth that you dry your hand with and use that to open the door. And then there should be a trash can on the outside. And if it isn't, find one and throw it away outside so that you haven't recontaminated your hands in any way, shape, or form. I want to show you a item that we purchased also here at ASAP. This is a ultraviolet ozone light. We bought it on Amazon. It was about $170. And this light we turn on in our program at the end of the shift, and when everybody is out of the building. It goes for a couple of hours, I believe, and what it does is it cleans and kills all of the viruses in the space. These are used in hospitals and so forth. I bought a tiny one for my home for us to sanitize the doorknobs and our cell phones and computers and things of that nature. So go online. We got them at Amazon, and see if that's something that might be beneficial to you. You do have to be out of the space. If you have pets and you buy it for your home, your pets have to be out of the space for an hour after the light does its thing. But you can go for a walk and get some fresh air while you sanitize your home with that. But, use precautions, be safe, read the directions. And, every time I hear about somebody eating soap pods, I realize that we have to always tell people what not to do before they do something that might hurt themselves. And I'm reminded that 500 people did drink bleach after they were told that bleach was a good thing for them. So I want to talk about a little bit of the activities. One of the things that Carla and I, we only have, time flies, has told me is that our families, even though the YouTube videos that we're doing with activities, everything that we're doing, sending activity kits, everything, we still have family members that are having a difficult time keeping their loved one engaged at home because they're home now 24/7. So we want them to know that please go to YouTube. We have put up a massive amount of videos, and as of next week, we will be putting up one every day. So please go to Alzheimer's Services of the East Bay, our YouTube channel. We've got exercise, we've got bingo. But yeah, so please go on our website and pull those videos down and share those with anyone that you know that is caregiving. The activities are relational, and they're set up to motivate people, and Diallo is doing exercise, and Katie the Hat Lady and Barry does his spiritual moment with the viewers. So go to Alzheimer's Services of the East Bay YouTube, and you'll find those videos there. I want to end the broadcast, the podcast, the Facebook Live this morning in saying to all of you, I continue to have incredible conversations around the globe with individuals around COVID-19 and Black Lives Matters and just humanity. And I want to thank all of those people who have shared their hearts with me. I want to thank all those people who have engaged in dialogue where we haven't fought each other and we haven't made excuses for our behavior. But I want to say to all of you, this is not a moment just to have a sign, just to wear a t-shirt.
60 seconds.
This is a moment of change. And so be the change that you want to see in the world. Engage people in conversation. Don't let this just be a moment in time. Let us change the trajectory of our humanity so that those that come behind us won't have to deal with racism or any other form of ism, ageism, all of it. It's time for us to rise up and be the humanity that we claim we are. And if we say we're all in this together, then let us be all in this together. And so my name is Micheal Pope, and this has been another podcast, Facebook Live, YouTube video of Life is a Sacred Journey. And it's my honor to serve you. It is my honor to be here. Have a great weekend. 10 seconds. Have a great weekend. Be good to yourself. Hug somebody. Hug a tree. You know what? Hug a tree. There you go. Go out and hug a tree. It'll make you feel real good. Have a great day, and thank you for joining us this morning. Peace and blessing.